Hello everyone, I'm Salwa and today we'll be seeing about the introduction of inflammation, and this is a very important topic in pathology, and we'll see the introduction in this video followed by acute chronic inflammation and so on. So let us start. First we have to know about the definition of inflammation. It is the response of vascularized tissue that delivers leukocytes and molecules of host defense from the circulation to the site of infection and cell damage in order to eliminate the offending agents. Now I know that the definition is quite huge, but if we understand it, it will be easy to write the definition. For now, we'll understand the concept and then try to read the definition again, which will be easier. So first, we have to remember 5 R's. That is, recognition, recruitment, removal, regulation, and repair. First, we'll see what is meant by recognition. This is the first initiating stimuli for inflammation. Here, cells like macrophages, dendritic cells, and mast cells, they have some receptors that will recognize the microbes and the necrotic tissue. These microbes and necrotic tissue will have some substance which will go and trigger the receptors in the macrophage, dendritic cells, and mast cells. Next, after being recognized, there will be recruitment of leukocytes and plasma cells. In leukocytes, mainly neutrophils, then followed by monocytes, then lymphocytes. There will be recruitment of these cells from the blood circulation to the extravascular site. For this, there will be vasodilation and increased permeability. In this picture, you can see that the cells are coming out from the circulation. Next, there will be removal. That is, there is removal of all the microbes and dead tissue, followed by there will be removal of stimulus. That is, they have already killed the microbes and the dead tissue, so there will be removal of stimulus because we do not want persistent inflammation to happen. Then finally, there will be regulation by cytokines and growth factors. Slowly, there will be laying down of fibroblast, extracellular matrix proteins and cells, and this will lead to the repair of cells. So the 5 R's are recognition, recruitment, removal, regulation, and at last, repair. Now, we have to see about the 5 cardinal signs of inflammation. These are pain, dolor, heat, calor, redness, rubor, swelling, tumor, and loss of function, that is functiolesa. Amongst this, pain, heat, redness, and swelling were described by Celsus, and loss of function was added by Virchow. Virchow is also the father of modern pathology. Next, after the 5 cardinal signs of inflammation, next we have to know the 2 major types of inflammation, which we have to know each in detail. This will be uploaded in subsequent videos. So first, we have to know the differences between acute inflammation and chronic inflammation. We already know that acute means it lasts for minutes to hours, whereas chronic means it lasts for days. Whereas the cells involved in acute inflammation are predominantly neutrophils, and in chronic inflammation are predominantly monocytes or macrophages or even lymphocytes. In acute inflammation, there is mild tissue injury, but in chronic inflammation, there will be severe and progressive inflammation happening from days to years. Next, local reactions will be more prominent in acute inflammation, whereas in chronic inflammation, the local and systemic signs are less prominent. That is, it is prolonged for years and then the symptoms will be less prominent. There is one exception to be noted that we have already seen that neutrophils are the predominant cells in acute inflammation. Here in acute typhoid fever, there will be lymphocytosis. That is, instead of neutrophils, there will be more lymphocytes. Whereas in chronic inflammation, the exception is in chronic Pseudomonas infection, there will be neutrophilia compared to increased monocytes and macrophages. So these are the broad differences between acute inflammation and chronic inflammation. We'll see each one in detail in the next videos. Now let us look at the definition of inflammation again. So it is the response of vascularized tissue that delivers leukocytes and molecules of host defense from the circulation to the site of infection and cell damage in order to eliminate the offending agents. I hope you understood the basics of inflammation. In the next video, we'll be seeing about acute inflammation followed by chronic inflammation. If you like my videos, do like, subscribe, and hit the bell icon. Thank you.